Definition. Mutation in AF1 in recessive primary ovarian insufficiency. Definition. Non-syndromic primary ovarian insufficiency, which is characterized by amenorrhea with elevated gonadotropin level is observed in 1% of otherwise healthy women under the age of 40 years. Its heterogeneous size and most cases appear to be sporadic, yet familial cases are observed in approximately 12 of patients.
In tonight's Health Check, imagine being a teenager and having hot flashes, migraines, insomnia, and other symptoms of menopause. It's not as rare as you might think. Doctors at NIH have treated more than 1,000 young women and girls with premature menopause, but they say many more may be suffering from it, and they don't even know it. Audrey Barnes has more on that.
Do you want me to read for you?
Yeah.
Karima Hijan and her husband Ted have a healthy 2.5-year-old son, but shortly after he was born in December of 2004, Karima started having some unusual symptoms.
My periods started becoming very light, started having severe migraines, and then I started having hot flashes.
It felt like she was going into menopause at age 33. As it turns out, she was, confirmed by an FSH blood test. That stands for follicle-stimulating hormone.
I started looking at my son and I said, I don't think he's going to be able to have brothers or sisters. It just was sad.
Karima went online and found out the National Institutes of Health was treating and studying women and girls with premature menopause, some as young as 13. So she joined the clinical trial.
Swallow for me.
NIH researchers prefer to call it premature ovarian insufficiency because the ovaries will work intermittently and about 5 to 10% of the women will get pregnant. The condition affects 1% of women by age 40.
Can you reverse it?
There's no real proven therapies to make the ovary work normally again. But it is possible to replace the hormones that the ovary make.
Not replacing those hormones puts young women and girls at risk for osteoporosis.
The end of July will be the third month for the HRT treatment.
Doctors at NIH believe in younger women, hormone replacement therapy is much more beneficial than harmful.
The bone health is very important, especially in the long term. So I like them to keep the long-term goal in the sight.
What do you hope? Feel better. Hopefully one day they will find a cure.
A diagnosis of premature menopause is devastating for these young women and girls, so they are offered counseling to deal with the loss and options to consider to enlarge their families. Karima wanted to tell us her story so that other women experiencing missed periods and other menopausal symptoms know to ask their doctors for that blood test before it's too late.
It's hard to imagine a 13-year-old or
Yes.
a 20-year-old going through this. Any idea what causes it?
You know, in 90% of the cases, they don't know what causes it, and most of the time, there's no family history either. Dr. Nelson said something that was pretty interesting. He said women need to treat their menstrual cycles like any other vital sign. If it's not regular, talk to your doctor and get that blood test.
All right. Thanks, Audrey. We wish her well. As you
Yes.
can see how emotional it is for her.
Yes.
Although there is no direct evidence that meiotic gene expression is involved in this disorder, several meiotic genes kinochromosomines have phenotypes resembling human primary ovarian insufficiency. In this study, some sequencing of samples obtained from 2 Chinese sisters with primary ovarian insufficiency and their parents led to this identification. Pros and cons. The mother and father each carry one of the mutations and both parents were clinically normal. Sequence of HF1 in an additional core of 69 Chinese government why sporadic primary ovarian insufficiency. Identify another compound heterozygous mutation. Test variants were not found. 316 control wins were matched for a gene background cells and eyes, with evidence or indicators from the 1000 genomes. Genomes?
Premature ovarian aging encompasses a spectrum of disorders that all culminate in cessation of ovarian function by age 40. And other names also used are premature ovarian insufficiency or premature ovarian failure. So these women present with symptoms of early menopause. And in individuals where the ovary is affected, which accounts for vast majority of premature ovarian aging cases, the follicle-stimulating hormone is elevated. Now, treatment options for individuals with premature ovarian aging does depend on the etiology as well as when they are diagnosed. Early diagnosis is very important because it will allow these individuals to undergo cryopreservation of their oocytes and their tissue, as well as it will provide timely management for health conditions they can develop as a result of premature ovarian aging. Some of these individuals may be Fragile X permutation carriers. As Fragile X permutation carriers, they are at risk of having children with Fragile X syndrome. Also, individuals with premature ovarian aging are prone to infertility, and we do know that infertility is associated with high risk for structural birth defects. Some individuals with premature ovarian aging are at risk for chromosomal instability syndromes. So in these particular individuals, they may present with not only ovarian aging, but they also may have other endocrine failures such as hypothyroidism. In these individuals, they are at risk for developing cancers. We also know that individuals with premature ovarian aging are at high risk for bone loss, as well as high risk of cardiovascular disorders, and they will need very careful follow-up to optimize their cardiovascular health. At UPMC here, what we are doing is we are trying to identify biomarkers of early ovarian aging, and we are using genetics to do that. And we do know that a number of individuals with premature ovarian aging have genetic defects. What we are researching is ways to correct these genetic defects and use the individual's own skin cells to transform them into eggs that can then be fertilized and allow them to have a family. UPMC provides a large number of specialists, which include geneticists, maternal fetal medicine individuals, reproductive endocrinologists, internists, that together can maximize both the reproductive success but also other sequelae of premature ovarian aging.
I believe various genes that affect the normal process of primordial germinal cell proliferation and migration, oocyte meiosis and follicle formation and activation are possible candidates in the pathogenesis of primary ovarian insufficiency. However, because of the small sample size of the study, no conclusion could be made regarding the likely pathogenesis of the variants. Subject: the mutation in genes encoding proteins that regulates meiosis can result in autosomal recessive primary ovarian insufficiency in humans, although orphan is confirmation by independent groups. However, our results are consistent with the finding the H, F, and 1 definition might sort refer to.
You know, there's been so many patients that we worked with. Like, I could just sit here all day and tell you stories, but, you know, another really interesting woman that I had the opportunity to work with, she had an FSH of 50. So FSH is the follicle stimulating hormone. Its job is to stimulate the ovaries to release an egg. It's a feedback mechanism, and so the more receptive that the ovaries are to being stimulated, that number will be lower. And so as they get older, as your ovaries get older, they sort of get deaf to FSH. And so, you know, the pituitary gland is secreting FSH, and the ovaries are like, what? And you have to keep secreting more and more FSH, and that number goes higher and higher. When the FSH goes above 10, it's very unfortunate, because that tells us that you have about a 1 or less than 1% chance of conceiving naturally. So it's a very pivotal point. It isn't set in stone, but that's what the current data show. So this woman came to us, and she was in premature ovarian failure, and her FSH was 50. So we had no conversations that acupuncture or Chinese herbs or the conceivable program was going to help her get pregnant. We were trying to just prep her for a donor egg cycle. Like, her FSH was so high that she couldn't even use her own eggs. But she was taking her basal body temperature, so I was looking at her chart, and she came in on the day after Christmas, and I was looking at her chart, and I said, it's weird, because her temperatures were very high after ovulation, which indicates a lot of progesterone production. And I said, it's weird because it looks like you're pregnant. And she said, well, you're a very good doctor because I am. And she had gotten pregnant naturally. And again, this is not an everyday occurrence. Certainly women with elevated FSH in our practice using the conceivable program do get pregnant sometimes, but not typically with FSH of 50. And so I told her I was going to do a victory lap around the table. I was so excited. She was very happy too, because the donor cycle is like $40,000, and they canceled the cycle.